Question 1, enzyme deficiency and clinical severity. Which of the following enzyme deficiencies is associated with a more severe presentation of galactose metabolism disorder, including jaundice, hepatomegaly, and risk of E. coli sepsis? A. B. Aldose reductase. C. Galactose epimerase. D. Galactose 1-phosphate uridyl transferase, GALT. E. Fructokinase. Correct answer D. Galactose 1-phosphate uridyl transferase. Explanation: classic galactosemia, deficiency of GALT. Galactose 1-phosphate accumulates, leads to hepatic and CNS toxicity. Symptoms appear after milk ingestion, jaundice, vomiting, hepatomegaly, cataracts, intellectual disability. Risk of E. coli sepsis. A equals causes mild form, only cataracts. B equals converts galactose to galactitol, but is not the primary defect. C equals rare variant. E equals related to fructose metabolism. Question 2, cataracts and galactose disorders. A newborn has bilateral cataracts, but no hepatomegaly or hypoglycemia. Urine is positive for reducing sugars, but glucose dipstick is negative. What is the most likely diagnosis? A. Classic galactosemia. B. Galactokinase deficiency. C. Fructokinase deficiency. D. Glucose 6-phosphatase deficiency. E. Pyruvate kinase deficiency. Correct answer B. Galactokinase deficiency. Explanation: galactokinase deficiency leads to accumulation of galactose, which is converted to galactitol by aldose reductase. Galactitol accumulates in lens, leads to infantile cataracts. Dipstick is negative for glucose, but reducing sugar test is positive. A equals would have liver symptoms. C equals no cataracts, benign. D equals causes von Gierke, hypoglycemia, lactic acidosis. E equals causes hemolytic anemia. Question 3, pathophysiology of classic galactosemia. Which of the following best explains the multi-organ damage seen in classic galactosemia? A. Accumulation of glucose 6-phosphate. B. Accumulation of galactitol and galactose 1-phosphate. C. Inhibition of aldolase B. D. Loss of mitochondrial membrane potential. E. Failure of lactase to break down lactose. Correct answer B. Accumulation of galactitol and galactose 1-phosphate. Explanation: GALT deficiency, galactose 1-phosphate, which is toxic to liver and CNS. Also galactose, which is converted to galactitol by aldose reductase. Galactitol accumulates in lens, cataracts. Toxic metabolites impair hepatic function, growth, and neurodevelopment. A equals seen in other glycogen storage disorders. C relates to fructose metabolism. D mitochondrial dysfunction, unrelated. E equals lactose intolerance causes GI symptoms, not systemic disease. Question 4, inheritance pattern and at-risk populations. Classic galactosemia is inherited in which of the following patterns? A. X-linked recessive. B. Autosomal dominant. C. Autosomal recessive. D. Mitochondrial inheritance. E. Imprinting disorder. Correct answer C. Autosomal recessive. Explanation: both classic galactosemia and galactokinase deficiency are inherited in an autosomal recessive pattern, often detected on newborn screening. Early treatment with dietary restriction is essential to prevent complications. A equals e.g. G6PD deficiency. B equals not the case here. D equals mitochondrial disorders come from maternal DNA. E applies to conditions like Prader-Willi-Angelman. Question 5, dietary management. Which of the following is the appropriate treatment for an infant diagnosed with classic galactosemia? A. Eliminate glucose only. B. Switch to fructose-rich formulas. C. Remove galactose and lactose from diet. D. Vitamin B1 and niacin supplementation. E. High-fiber, low-fat diet. Answer C. Remove galactose and lactose from diet. Explanation: lactose equals glucose galactose. Removing lactose-containing products like breast milk and formula prevents accumulation of toxic metabolites. Soy formula or galactose-free formulas are used. A equals glucose is not the problem. B equals may worsen in other metabolic disorders. D equals unrelated to the pathology. E, not specific or effective. Would you like a comparison